Dog bites tend to be a common trauma we see here at Akron Children's Hospital. Younger children tend to have worse injuries and more common to have injuries associated from dog bites. They are around dogs at eye level with dogs and getting used to dogs more than older children. The type of injuries you most commonly see with dogs include anything from cuts and lacerations on the less severe, all the way up to broken bones. Across the spectrum, injuries to the head, to the neck, to the face are definitely the most common, and the mechanism is that kids lead with their head or with their face and get into the face or be involved with the dog. The most common dog that people get injured from are dogs that are well known to the family. About 8 out of 10 times that someone comes in with a dog bite, that dog is known to the family. If your child gets bit, the first thing is to make sure your child is safe. So if it's you want to move your child to a safe environment away from that dog, then it's figuring out the severity of injury to see if you need to call ambulance or the emergency medical services to bring your child emergently to the hospital, or if it's a less severe injury that would not need to go to the hospital but can be evaluated by the pediatrician. Part of that evaluation, you want to see if you can find out if the dog is vaccinated for rabies, to see if your child needs to have rabies prophylaxis. Dog bites are associated with a high risk of infection, so your child will probably need some sort of antibiotics. If your child's not up to date on tetanus prophylaxis, will probably need to be updated for tetanus. If you don't have to seek medical advice right away, you definitely want to wash out that cut with soap and water right away to decrease the risk of infection in the interlude before seeking help from the pediatrician or advice from your pediatrician. Prevention of dog bites largely revolves around education, educating your children to ask permission before approaching dogs not known to them. Also educating your children how to be around dogs, not pulling on them, not approaching them from the rear and startling them, or grabbing around their face, which can be deemed aggressive.